Hi everyone, Dr. Sunil Dhand. Welcome to another video. I'd like to think those of you who follow me here, watch my videos, do so because you want open, honest debate. You want to arrive at your own conclusions, you don't want anything shoved in your face, and above all else, you want to live in reality. So on that note, I want to talk about two very important statistical concepts, especially as they apply to medical studies and research results. And these are known as relative risk reduction and absolute risk reduction. And I made a brief intro video previously on this topic, that link is down below. But I want to stress how important it is to know what these two numbers are, particularly when you are talking about any intervention in medicine. Because often, many out there will have an incentive to push relative risk reduction, which can exaggerate the effects of any particular intervention. And often, no surprises, that is coming from a company or organization, business, which will benefit from the particular intervention, frequently in a monetary way. It could be big pharma or it could be another company. So they will want to push relative risk reduction over absolute risk reduction because it does tend to exaggerate study results. But it's really important in medicine and science to know these two numbers, and if they are not quoted in the initial studies, you can easily calculate them from the actual data that is presented. But a truly open, honest study should actually present both numbers. So let's think about what both of these concepts actually mean, and I'm going to draw upon an example. So let's just say you have an illness or outcome that occurs in 10 out of every 10,000 people. You have an intervention, which could be a medical therapeutic or something else, and it reduces the numbers to 2 in 10,000 people. Now the relative risk reduction going from 10 to 2 people would be 80%. Wow, 80%, that sounds very impressive indeed. However, the absolute risk reduction, considering the total numbers of people, means that the rate goes from 0.1%, which is 10 out of every 10,000 people, to 2 in 10,000 people, which is 0.02%, yielding an absolute risk reduction of 0.08%. So can you see how 80% sounds much better than 0.08%, but they're both referring to an aspect of the risk reduction, the relative risk reduction and the absolute risk reduction. So you can see from that example the enormous difference between relative risk reduction and absolute risk reduction. And that's why it's so important to know both of these concepts. And actually, when you often tear apart and break apart studies further, you find that the particular intervention applied much more to a certain subgroup, whether that's an age demographic or people who lived in a certain city. Therefore, you can't extrapolate the results to everybody. So let me give you a different example to highlight this point. If you do a motorcycle test, research shows that your relative risk reduction of having an accident will go down by 80%. Therefore, here's the test, do it. But I don't drive a motorcycle, why do I have to do the test? No, you don't understand. 80% risk reduction, do the test. But I've never driven a motorcycle and never will. No, 80%, do the test. Do you get what I'm talking about here? We have to consider subgroups as well. So this gets back to the way we practice medicine as well at the front lines, and doctors actually knowing this data as well. Now, doctors work very hard and practice miracles at the front lines every single day. We work with some amazing technologies and can do things now that we couldn't do a few years ago. But often doctors are too busy to know this data ourselves. And there is a feeling in our profession sometimes that knowing numbers and statistics makes you smart. But it is not smart to just hear something, whether it's being promoted by an organization or frequently a big business, big pharma, and mindlessly repeat that data. Say a 72% risk reduction from this intervention, 72% risk reduction, 72% risk reduction, and repeating it robotically. That's not smart. You know what is smart? Breaking apart studies, tearing apart data yourselves and thinking yourselves. And this goes way back actually to medical schools. Now there are lots of ways that medical schools all across the world are going wrong that I could talk for a long time about. I think the goal of producing good, competent doctors frequently is missed as medical schools are thinking about other things and teaching things which have nothing to do with the good, competent practice of medicine. But one thing that medical schools don't do and haven't done for a long time is to encourage critical thinking skills in future doctors. It is not enough to mindlessly regurgitate facts. Look at the data, it's all available, analyze it yourself, tear it apart, and break it down and ask the right questions. That is smart. In fact, nowadays, people who do ask questions, whether it's a medical professional or even a patient, we're in the absurd situation now in 2022 where they are the odd ones out. What an affront to good medicine and science. This should be being encouraged. So I would say this: if you are out there and you are faced with any particular choice regarding an intervention or something is being promoted to you, then of course the least that the professional should know if they are promoting something is what is the relative risk reduction and the absolute risk reduction, because relative risk reduction can exaggerate study results and make things sound much better than they are. And particularly this happens a lot nowadays. We're talking about expensive interventions a lot of the time. If something is very expensive, then you should know the true data behind it so you can make the right informed choice. Thanks everybody for listening. Dr. Sunil Dhand. Do let me know your thoughts down below. We'll be talking much more about this with specific examples in the future. Do hit the subscribe button for more similar videos in the future. You can also follow me on my uncensored platform. That link is down below, where we have more open, honest discussions in a less constrained, less censored environment. You can also check out my newsletter. That link is down below too. And we will talk again very soon.